Good afternoon. My name is Edwin Rotker,
Chelsea Bryant.
Michelle. Chawanucity Panya.
and we are Cohort 17, part of Concorde Career College's dental hygiene program. Today, we're going to be going over partial and complete airway obstructions. The airway obstructions, as most people think of, are when individuals are choking. An individual who's choking, we normally relate that to individuals who are eating food. But did you know that in the dental setting, there are a lot of different things that individuals could choke on, like cotton rolls, 2x2s, and small pieces of instruments that can also be introduced into the oral airway. Those pieces could end up in the airway, causing the individual to choke, which could become a medical emergency. Our dental hygienist, Miss Medell, is going to go ahead and bring back our patient, Nikki, into the operatory so that way she can begin treatment. We're going to follow Miss Medell into the waiting area so she can get her patient. Our doctor on staff today is Dr. Bryant, Chelsea Bryant.
I'm ready to see Nikki.
Yes.
Hi, Nikki. How are you today?
Good.
You can come right this way and follow me over here.
Miss Medell is bringing the patient into the operatory. She's going to go ahead and sit her down and begin her evaluation of the patient.
Okay, Nikki. Today, I'm just going to go over a few things of your medical history before I take your blood pressure and your temperature.
Okay.
Are you feeling sick today?
No, I'm feeling
Any
good.
COVID symptoms?
No, I never had it.
Okay, good. And have you been hospitalized recently?
No, I never.
Okay. And are you experiencing anything in your mouth that might be of a concern?
No.
Okay, good. Okay, let me start by taking your temperature, okay? Okay, you have a normal temperature of 97.5. Okay. I'm going to go ahead and take your blood pressure.
It is very, very important that all dental and medical staff know and recognize the signs and symptoms of a partial or obstructed airway. Some of those signs and symptoms are coughing, cyanosis, which is the changing of the color of the skin like to blue or gray, hands on the throat, which is the universal choking sign, which you see all throughout restaurants and medical areas on posters, and wheezing and dyspnea, which is difficulty breathing.
Okay, Nikki, it looks like you're super healthy. Your blood pressure was 116/74. That's really good. Let me just write this down in your medical history, okay?
Yes.
Okay.
Now-
And so today you're just going to be here for a cleaning, correct?
Yes. Correct.
Okay. Okay, so while I'm going to be noting your information in the computer, I'm going to have you chew on this. This is called a disclosing tablet, and this is detects plaque, okay? There you go.
So at this moment, Miss Nikki is going to go ahead and put the disclosing tablet in her mouth, and as she's chewing on that, she starts choking.
Are you okay? Are you okay?
Miss Medell is evaluating this patient at this time. Just by talking to her, If the individual can speak, talk back to her, that tells her that the individual has a partial airway obstruction. And if you noticed earlier, she was able to speak, but now Nikki cannot speak, and it's gone to a complete airway obstruction.
Are you able to cough? Are you able to talk? She's suffering from a complete airway obstruction now. I think I'm just gonna have to call the doctor. I don't know what to do. Dr. Bryant, my patient right here, she just started choking on the disclosing tablet. I don't know what to do.
Okay, we're gonna have to stand the patient up.
Okay, stand up.
If you notice, Dr. Bryan is talking to the patient. At this moment in time, an individual who is choking with a complete airway obstruction will be panicking and most likely not be willing to do what you want them to do. That's why it's imperative that you tell them what you're doing, you explain what you're doing, so that way they help and participate.
Okay, so I got you stood up. I'm gonna perform the Heimlich maneuver. Okay, I'm gonna put my fists in your chest, and I'm gonna do deep thrust.
Dr. Bryant is activating what is called CAB. She is evaluating the circulation, the airway, and the breathing, as Ms. Medell did earlier for this patient. She's doing the Heimlich maneuver until either the individual expels the foreign object in the mouth or the individual goes unconscious. As we saw in this video.
It's out. She spit it out.
Okay.
Are you okay, Nikki?
Okay, let's
Are
have
you
her
okay?
take a seat.
Are you able to breathe? Did you get everything out?
I think so.
Okay.
I think just the tablet make me cannot cough or anything.
Oh, okay. Do you need us to call EMS?
Not right now. I don't think I need it right now. I feel better.
Okay.
The doctor help.
Okay.
Ms. Medell was able to implement the appropriate emergency protocol for her dental clinic. That was activating her doctor on call or the doctor in the clinic. Also, activating 911 if needed. Also, getting the AED and any other emergency kit that is found in their clinic. Make sure that all your equipment, medications are all up to date and you're checking everything constantly. You're also going to continue to check on the patient. You're not just going to ask them that one simple question if they're okay and walk away. You need to make sure that they stay that way. And also, Dr. Bryant and Ms. Medell would refer the patient to see a physician if necessary in either an emergency room setting or their primary care doctor.
Okay, Ms. Nick, does this happen often?
No, it's the first time that happened today, and it's never happened like
Are you
this.
allergic to dye or anything?
No, I don't think so. It just accidentally happened today.
Okay, no allergies, nothing was in her medical
No,
history?
she's pretty healthy. Everything was pretty normal. So maybe she just inhaled the tablet. But doctor, I do recommend maybe not seeing her today since she had this incident.
Okay,
That
all right.
sounds good for me.
Yes, so we're gonna just monitor. You're gonna let you sit for a while and make sure your respiratory and everything is fine. But if this continues, I think we need to recommend going to see your physician.
Okay, that sounds good. Thank you so much.
Okay.
Doctor, I do have a question though. What if she would have gone unconscious?
Okay, had you went unconscious at that time, we would have performed CPR.
Oh.
Yes.
We were very fortunate today. Our patient did not go unconscious and need CPR. If the individual goes unconscious while we're doing the Heimlich maneuver, we would lie the individual on the floor and begin CPR with chest compressions. The difference here with this CPR is every time we do airway, mouth to mouth, we would, or if you have a device to do the mouth to mouth, we would make sure we look into the oral cavity and see if we see the foreign object so we can remove it. We do not do what they call a blind finger sweep, which was taught in the past. We would first look, and if you see the foreign object, you try to pull it out. And then you give the mouth to mouth, and then you continue chest compressions. And that's the difference between normal CPR without airway obstruction and this type of CPR. Any more comments or concerns from the staff?
No.
And that will conclude our airway obstruction briefing. Thank you.